morning. My name is Joanne DeBaggis, and I'm the Asthma Care Coordinator at Westwood Mansfield Pediatrics. And today I'd like to talk to you about how to use your asthma inhalers. But before I go over the various types of inhalers, first I want to tell you about the two different types of inhalers your child may be using. The first one is a bronchodilator. A bronchodilator works by opening up the airways in your lungs. And the bronchodilator is what we call a rescue inhaler. A rescue inhaler is used when your child is having increased asthma symptoms such as wheezing, shortness of breath, or coughing. It's important to know that you shouldn't be using this inhaler more frequently than every 4 hours. Sometimes we do have a nighttime asthma action plan, and sometimes you may have to use it more for more severe symptoms. However, if your child does need to use their rescue inhaler 4 or more times a day, you should be calling the office to possibly set up an appointment because they may not be in good control. These inhalers are known as ProAir, that's the brand name, albuterol, or you may even have a Ventolin inhaler, but they're all bronchodilators. Or you may use the albuterol in a nebulizer. The second type of medication is an inhaled corticosteroid. Inhaled corticosteroids are more of a controller medication. They work by decreasing inflammation inside the lungs. Your child may be prescribed an inhaled corticosteroid, and they may use it once or twice a day. Sometimes also, when they're in the yellow zone, they may begin their inhaled corticosteroid. So they may not use it on a daily basis, but if their symptoms are flaring up, the yellow zone, when they're having increased symptoms, then you would begin the inhaled corticosteroid according to your provider's plan. So those are a couple of the different medications, inhalers that your child may be using. The important thing to remember with these inhalers, again, is that you follow the plan, your asthma action plan, and use them as directed. So now I'm going to go over some of the inhalers that your child may be using. The first inhaler is called a press and breathe inhaler. This inhaler works by aerosol, and this inhaler has to be primed before you use it. So what you're going to do is shake the inhaler, and the first time you use the inhaler, you're going to squirt out the first couple of puffs. So now it's primed and ready to use. What you're going to do, and it may be difficult for smaller children to do this because it's a press and breathe. You have to press the inhaler down and breathe in the mist at the same time. So this is what you're going to do. If possible, have your child hold that for 10 seconds and then breathe out. Okay, and then you can repeat the dose. So this is a press and breathe inhaler. Now, if your child needs to use an Aerochamber, what you're going to do is attach this end, the open end, to the Aerochamber like this, and then the mouthpiece will go in. You're going to press down and just have your child breathe in normally. Hold this in place for 10 seconds to make sure that the medication goes in. Take it out of their mouth and then repeat the second dose. If your child needs a mask, for younger children they may need a mask, you're going to attach this end to the mask like this and place it over your child's mouth and nose. You want to make sure that there's a tight seal so that they get the medication in. And even if they're just using the mouthpiece, make sure their mouth is completely around this so that they're getting the medication in. So this is a press and breathe inhaler. And probably most of you are familiar with these if you've been using inhalers. The next type I'm going to demonstrate is a newer kind. It's a QVAR Red inhaler. The QVAR Red inhaler is an inhaled corticosteroid. The QVAR Red inhaler works by loading the dose when you open the cap. This inhaler is a dry powder, and you do not have to shake it and you do not have to prime it. So it's really easy to use. The important thing to remember though is between doses you have to close the cap before the second dose because opening and closing the cap loads the next dose. So what you're gonna do, and you should always try to take a deep breath in and out before putting the inhaler in your mouth. So you're gonna do that, and then no shaking, no priming. Put the inhaler in your mouth, deep breath in for 10 seconds, and close the cap. Before you do the next dose, same thing, close the cap. You have to remember to do that in between the doses to load it. So this is really easy to use. It may be good for older children to use these. The next one is a Pulmicort Flexhaler. Again, Pulmicort is an inhaled corticosteroid. It's also a dry powder inhaler. This one works by, there's a cap, you're just gonna twist it and take the cap off. Now this one has a brown grip on the bottom. In order to load the dose, you're gonna turn it one way and then the other way. It doesn't matter if you turn it right to left or left to right, but you have to turn it both ways to load the dose. After you do that, again, deep breath in and out. You hold this one horizontally because the mouthpiece is on the end. Deep breath in, hold it 10 seconds, and breathe out. If you need a second dose, you have to do this again. Turn it one way and the other way because that loads the dose. So this is the Pulmicort Flexhaler, which you might be seeing. And the last one I'm going to demonstrate is the ProAir RespirClip. ProAir is one of the bronchodilators, one of the rescue medications. This one is like the QVAR Ready Inhaler. Same thing. When you open the cap, you're going to hear a click. That loads the dose in. No shaking, no priming. None of the dry powder inhalers need shaking or priming. So to open the cap, that loads the dose. Deep breath in and out. There is a vent in the front of this one, so make sure you don't block it when you're holding it. Breathe in, very important. Close the cap. Now you're ready for the next dose. Open it, you hear the click, and take the second puff in. So these are some newer inhalers, you know, the dry powder ones, and they work, which is great because you don't have to shake them or prime them. But they're breath actuated, so you have to make sure that your child can take that deep breath in to get the medication in their lungs. All of these inhalers have numbers on the back which indicate how many doses are left. They're either on the back or on the Pulmicort one is, let's see, it's in here. So sometimes you have to look for them, but there are numbers, and that tells you how many doses you have left. It's really important to know when your inhaler is running low. And usually, I think most of them, the numbers are in red when it gets to the point where your doses are running low. So at that point, you should make sure that if you need a refill, you call our office so that your child doesn't run out of the inhaler. The other thing to remember with these inhalers, with all inhalers, is your child should rinse their mouth after using them. It's really important. You don't want the powder or the aerosol to stay on the back of your throat. So you should always rinse your mouth after using these inhalers. If your child is too small, just give them a drink. You know, it just kind of gets rid of the residue in the back of your throat. And that's it. If you guys have any questions, please make sure to call our office. There's always someone here to answer questions, either myself or one of the triage nurses. We're here to help you. We want to make sure that your child is in good control of their asthma. Thank you and have a great day.